All right.
Welcome, everyone. Gail and I are so pleased to be here today to discuss managing grief as pet care professionals and how to support your clients, their pets, and yourselves during this challenging journey. Gail's dedicated 30 years to caring for senior and special needs pets, focusing on animal hospice and end-of-life education. Similarly, I've provided palliative and hospice care for my own animals during that same time. Together at Animal Hospice Group, we train allied animal care practitioners how to support pet owners through their pets' end-of-life stages. As care practitioners ourselves, Gail and I provide consultations to clients whose pets are in various stages of end-of-life or hospice care. So at times in this presentation, we will say we rather than you, even though we are not pet sitters or dog walkers. Because when it comes to providing end-of-life and grief support like we'll be discussing today, we feel we have a lot in common with you. Our presentation draws on lessons from our students and the primary caregivers we support. It focuses on managing the prolonged grief and loss that comes with a pet's end of life. Supporting our clients and taking care of our own selves through a pet's end of life journey requires us to learn about how to handle the kind of loss and grief that is experienced over extended periods of time. And we're fully aware that there is limited support out there for how to handle the type of grief we and our clients experience and the steps we need to take. Because as you probably know, non-medical end-of-life support for pets and their owners can be quite hard to find. And today, we aim to address this gap by exploring practical steps and support strategies. So let's take a look at an overview of our session today. We want to start today by acknowledging something that each of us here knows all too well. The profound emotional journey of caring for pets who are nearing the end of their lives is a complex one. The love we share with these animals enriches our lives immeasurably, but it also means we open our hearts to profound grief when it's time to say goodbye. So we'll take a look at grief in the context of end-of-life care, understanding it not only as the sadness felt after a pet transitions, but as an emotion that starts when we recognize their time with us is limited due to aging, illness, or a difficult diagnosis. This is the path many of us walk not just once, but many times throughout our careers, carrying both our love for these animals and the sorrow of their loss. So we'll take a look at the essence of grief, uncover the various experiences of loss that emerge in our work. But there's something we both firmly believe and want you to hold on to this thought throughout our presentation. Our capacity to feel this deep grief is a reflection of the deep love and care we have for these pets. It's what makes us excellent at what we do. It's also what makes this work so incredibly challenging. If you're sitting here today feeling the weight of that grief, whether it's fresh or an accumulation of many losses over the years, we want you to know that you are not alone. Your feelings, whether they're sadness, guilt, anger, or even relief, are valid and important. They reflect the compassion and dedication you bring to your work every day. We'll discuss ways to support others while handling your own grief and share ideas for reducing the stress that pet owners experience, which in turn can ease your stress. We've prepared a handout on pet loss and grief resources to help you implement the strategies we discussed today. So do be sure to download it. We believe that by sharing some strategies and insights today, we can all find a little more peace and resilience in our work and in our lives. So let's look now at how we can navigate the unique path of grief in pet care and better support ourselves and the families who turn to us in their moments of need. To begin, we want to say a few words about why we named our presentation Walking Together. It is not just because it's what many of us do daily with the pets in our care, but because it embodies the principle of companioning from human end-of-life training programs. This approach emphasizes providing comfort by walking beside someone in pain, rather than attempting to fix their grief. Companioning is about offering a comforting presence and a listening ear, allowing bereaved pet owners to express their emotions freely and without judgment. It involves deeply listening and empathizing from their perspective, recognizing the unique nature of their grief and their special relationship with their pet. This is a concept put forward by Dr. Alan Wolfelt, a renowned grief counselor and educator known for his extensive work on grief, including a notable book on pet loss grief. If you're not familiar with Dr. Wolfelt, we highly recommend exploring his writings. By embracing the ideas of companioning and walking together, you can provide a supportive, empathetic presence that respects each pet owner's individual grieving process. This approach ensures that we don't rush their experiences of grief or push for premature acceptance of their loss. Now let's briefly touch on the stages of grief that you and your clients might navigate as you provide care for pets with challenging diagnoses. At the heart of our philosophy for handling grief and loss during end-of-life care is our holistic care wheel, which provides a framework for understanding how grief evolves as a pet's condition changes. This wheel guides our approach, emphasizing emotional, psychological, and spiritual support alongside medical care for pets and their families. Our journey in end-of-life care starts with the pet's life-changing diagnosis, requiring immediate support and education to help the pet owners cope with the shock and implications. This care extends beyond medical needs to address the emotional and spiritual well-being of both the pets and their caregivers. Each phase of the wheel involves different types of grief and emotions. Our aim is to prepare you to support pet owners through these transitions, ensuring decisions reflect their values as well as the needs of their pets. We use colors on the wheel to indicate different aspects of care. Blue for medical involvement, white for areas where the pet parent is the primary caregiver, often feeling isolated, and orange for the inner emotional experiences of pet families and their caregivers. These colors help illustrate where families need more support, which is often lacking. As pet care professionals, we repeatedly navigate these phases with each pet, carrying our love for the animals and the sadness of their eventual loss. By understanding and anticipating these stages, we can better support pet owners in managing their grief, which begins with the initial diagnosis and often involves anticipatory grief, which we'll say more about later. Our approach is holistic, aiming to empower pet owners through education to make more informed day-to-day care decisions, which reduces later levels of guilt and regret, which of course, as we know, can complicate grief recovery. We encourage regular, even daily quality of life assessments and informed decisions about end-of-life care, including the deeply personal choice between natural passing and euthanasia. All too often, pet owners find themselves making hasty decisions and feeling under pressure to do so, which can complicate and deepen their grief when they question themselves later on. Recognizing the ties between end-of-life decisions, aftercare, and memorial practices is essential, as they reflect societal views on death and are intertwined in phases 4, 5, and 6 of our wheel. Grief is an integral and inescapable part of these interconnected decisions. Choosing between cremation, burial, and other aftercare methods is a deeply personal decision for pet owners, influenced by factors such as cost, environmental concerns, and religious or memorial preferences. Currently, cremation is the predominant choice, with over 90% of pets being cremated, a rate that surpasses human burial, which occurs about 50% of the time. This shift toward cremation is partly due to its integration with euthanasia services, whether at home or in a clinic, and veterinary clinics often work with local crematoriums to manage pet remains. This collaboration can ease the logistical burden for grieving families. but it also reduces personal involvement in these steps of the grieving process, potentially affecting emotional recovery. Unlike human loss, pet loss rarely involves traditions like wakes or funerals, which means pet owners often face their grief without the communal support and rituals that provide closure, navigating their sorrow largely on their own. This absence of traditional human mourning rituals for pets has prompted owners to find unique ways to honor their companions, from personalized memorials that integrate a pet's ashes into jewelry or home decor, to creating new rituals that celebrate a pet's life. These practices offer comfort and closure. And to bring this overview full circle, it's important to point out that engaging in day-to-day hospice or end-of-life care itself becomes a form of ritual, filled with daily routines and special moments that honor the pet's life. Understanding these phases helps us support the emotional well-being of pet owners, providing a structured approach to anticipatory grief and preparation for loss. Now that we've taken a look at the end-of-life context of grief about a pet's loss, let's turn our attention to grief itself. We'll delve deeper into the nature of grief itself in our next slide. Gail, I'll turn things over to you.
Thank you, Karen. Okay, and so now let us take a look at the essence of grief, rather than trying to come up with one single definition for it. The essence of grief is an intrinsic part of the emotional journey we embark on when we experience loss. Whether as pet care professionals or simply as individuals, grasping the nature of grief is crucial to managing it effectively in both our professional and personal lives. First, it's important to recognize that grief is our natural response to loss. It's the emotional pain we feel when we lose someone or something important to us. This isn't just a reaction to the death of a beloved pet. It can also arise from the loss of a relationship, a career, a dream, or even a phase of life. As professionals who care for pets nearing the end of their lives, understanding this natural response helps us empathize with our clients and provide the support they need during these challenging times. Grief encompasses more than just emotional reactions. Its multifaceted nature affects us physically, psychologically, and spiritually. Recognizing these varied dimensions allows us to address our grief more holistically and to better support those who are grieving. We must acknowledge that grief is a deeply personal and varied experience. Each person's journey through grief is unique, influenced by their own personality, life experiences, and the nature of the loss. What helps one person might not help another, and what feels overwhelming one day may feel manageable the next. This variability requires us to be flexible and patient, both with ourselves and with the pet parents we support, as we navigate these highly emotional waters. Understanding the essence of grief as a natural, multifaceted, and deeply personal experience equips us to handle our own grief more effectively and be more compassionate in our professional roles. For some, grief is quiet and introspective, while for others it may be more outward and expressive. This diversity means that as pet care professionals, we again need to provide personalized support that respects each person's unique way of grieving. A fundamental aspect of grief, often misunderstood, is that grief is a process. It's not a timeline. This concept is crucial in how we approach our grief and how we can support others through theirs. Traditionally, grief has been depicted as a linear path, passing through set stages. However, the reality is far from this structured progression. There is no linear path that everyone follows. Grief is much more personal and can vary significantly from one individual to another. Understanding this helps us avoid setting expectations of how we or others should respond to loss, allowing us to respond more appropriately to our feelings or those of the clients that we're supporting. Grief also tends to ebb and flow over time. It's not unusual for someone to feel they're coping well one day, only to find themselves overwhelmed by grief the next. This fluctuation is a normal part of the process. As caregivers, recognizing and accepting this can help us and the clients we assist to be patient and gentle with ourselves during these ups and downs. Lastly, it's important to understand that grief may never completely end. The loss of a beloved pet can leave a lasting impact. And feelings of sadness or loss might re-emerge at unexpected times, such as anniversaries or during certain experiences that may remind us of the animal. This ongoing nature of grief doesn't mean it always remains as intense as initially, but it does mean it can become a part of our lives, shaping who we are and definitely how we see the world. Recognizing that grief is a process without a fixed timeline or predictable stages helps us to be more compassionate and understanding, again, with ourselves and with those we support. Embracing the complexities, we can provide a supportive space for healing at one's own pace, including our own. Let's now take a look at the unique aspects of grief that we experience in our work. First, there's a broad emotional spectrum. Grief is not a one-size-fits-all kind of emotion. It encompasses a broad spectrum from sadness and loneliness to anger and guilt. As pet sitters and dog walkers, you might see pet parents exhibiting these emotions, or you might experience them yourself after losing an animal that you've cared for. Recognizing these emotions as normal parts of grief can help in managing them more effectively and with greater compassion. There are both physical and psychological impacts. The impact of grief isn't limited to our emotions. It can manifest physically, as insomnia perhaps, lack of energy, or even nausea. Psychologically, it might feel like you're in a fog, making it hard to concentrate or make decisions. When you notice these symptoms in yourselves or others, it's important to take them seriously and consider seeking help, whether that's through rest, talking to someone, or via professional help. Grief can also affect our cognitive responses because grief can alter the way we think. It might lead you to keep ruminating over your last moments with an animal or question the fairness of life in never-ending loops, over and over. These thoughts are a natural part of the grieving process. However, being aware of these changes can help you to understand why you might be feeling disoriented or unusually caught up in your thoughts. You or your clients might start behaving differently. You might find yourself wanting to withdraw from social activities or from animal care tasks that remind you of a loss. Alternatively, some of us might just do the opposite and throw ourselves into work to avoid dealing with the sorrow. Observing these behaviors in yourselves or your clients can provide insights into how each person copes with their sadness. Grief is also shaped by our cultural background and societal norms, which influence how openly we express our emotions, as well as the types of mourning rituals we may follow. Understanding this can help you respect and support diverse responses to heartache amongst the pet owners you work with. Ultimately, grief is a process of adaptation. Over time, it can lead to a new understanding of life without the presence of who or what we have lost. This part of grief can lead to personal growth and a deepened capacity for empathy, qualities that are incredibly valuable in our line of work. Understanding the essence of grief enhances how we care for ourselves and how we support the pet owners and their beloved animals in our charge. By recognizing the multifaceted nature of grief, we can approach our roles with a deeper sense of empathy and preparedness, ensuring we continue to provide the compassionate care that is so crucial in times of loss. Let's take a look next at the 4 unique forms of grief that we, as pet care professionals, encounter most frequently. Understanding these can help us manage our own emotional health and also enhance the support we can offer to each other's and the families we serve. So let's begin with anticipatory grief. This is the grief we feel when we know a loss is coming, but it hasn't happened yet. For us, it might arrive during the course of caring for an animal who is aging or seriously ill. While this type of grief gives us time to prepare emotionally, it can also extend our period of mourning as we anticipate the day we'll have to say goodbye. It's like watching a slow sunset that you wish could linger forever, even as you know night must fall. The challenge here is to balance our emotional preparation with maintaining our presence and care for the animal and their family. Next, we have complicated grief, which is more intense and far longer lasting than typical grief reactions. This may arise when the bond with the animal was exceptionally strong, or when circumstances of the loss were traumatic or unexpected. As caregivers, we might find ourselves replaying the final days or moments, stuck in a loop of what ifs and if onlys. And this type of grief can feel like a maze from which there is no exit. Recognizing this in ourselves or our colleagues is crucial. It signals a need for supportive interventions and possibly professional help to navigate our way through to healing. Third, we encounter cumulative grief, which builds up over time as we experience multiple losses. Unlike most professions, the nature of our work exposes us to frequent goodbyes. Each loss may not only remind us of prior losses, but also add to an accumulating burden of sorrow. It's somewhat like carrying a backpack that just gets heavier with each and every step. To manage this, we need to develop practices and spaces that allow us to acknowledge and reflect on each loss, ensuring that we address our grief rather than let it accumulate. And lastly, let's discuss disenfranchised grief, which society does not openly acknowledge or validate. People might say, "Come on, it was just an animal," not understanding that to us and to the families we serve, these pets are our actual family members. This dismissal can make us feel isolated or trivialized, as if our emotions are not valid. Within our professional communities, we often validate each other's feelings and provide the recognition and support that the outside world might not. But our clients aren't usually that lucky, and they often find that co-workers, neighbors, friends, and even family members get frustrated when their heartbreak continues, and then they're urged to get over it. You've probably been in a situation where you've been told that you are one of the few people they can talk to who understands the loss and what they're going through. Whether it's the anticipatory mourning of an animal's decline, the entanglement of complicated grief, the heavy load of accumulative loss, or the silent ache of disenfranchised grief, each form affects us in profound ways. Recognizing these different forms, understanding how they impact us, and discussing them openly provides the first step toward managing our emotional health. It's important to find, make use of, or build a supportive community where we can find understanding and compassion, not just for our clients and their pets, but also for ourselves and each other. The unique complexities of grief within our field are often overlooked, and so I'm going to invite Karen to next explore not only the impact of losing the animals we care for, but also the cumulative emotional toll of empathizing with the pet parents we support. Over to you, Karen.
Thanks, Gail. Okay, now let's explore the unique aspects of pet care grief, highlighting why our grief can be particularly challenging. First, consider the empathetic strain of shared grief. Our work requires deep emotional investment as we open our hearts to both pets and their families. Balancing care for a pet while supporting grieving families is like walking a tightrope of emotions, where maintaining balance is crucial yet challenging. These layers of cumulative grief can build up over time, like Gail mentioned earlier, and are a recurring part of our jobs, where each loss adds a layer of sadness, potentially leading to compassion fatigue if not addressed. This isn't just about feeling sad. It's about becoming emotionally saturated, like a sponge that can no longer soak up any more water. The overlap between our professional responsibilities and our personal feelings often intensifies our grief. Each loss can feel like losing a part of our own family, blurring the lines between job duties and personal emotions. Unresolved grief can easily emerge in our fast-paced work environments where there's often little time to process emotions. And then each unprocessed emotion accumulates, affecting our well-being and can lead to serious mental health issues. Additionally, feelings of guilt and second-guessing often accompany the critical decisions we make, especially in end-of-life care. It's common to question whether we did enough or made the right decisions. These feelings of guilt can intertwine deeply with our grief, creating a complex emotional landscape that challenges both our peace of mind and our confidence. A critical yet often overlooked aspect of pet care grief is the societal under-recognition of loss. Unlike human bereavement, which is often widely acknowledged and supported, the loss of a pet may not be seen as a significant form of grief, exacerbating the emotional challenges we face. This societal attitude can leave us and our pet owners feeling isolated and unsupported, making it difficult to access the needed resources. Lastly, the dynamics of our support systems also play a critical role. Often our colleagues are grappling with their own grief, and those outside our field may not fully understand the depth of our connections with our clients. This can intensify our feelings of isolation. As pet care professionals, recognizing and addressing these multifaceted aspects of grief is essential. By understanding the unique challenges of our type of grief, we can better support each other and continue providing compassionate care while also taking care of our own emotional health. Now let's explore how we can effectively support our clients and their pets while managing our own grief. This delicate balance requires strategic emotional management alongside empathy and understanding. Key to this balance is maintaining empathy while setting clear emotional boundaries. This means offering support to grieving pet owners without becoming overwhelmed ourselves. For example, we can empathize by listening and acknowledging feelings, but should limit the length of conversations that become too emotionally draining for us. Communicating effectively is crucial, especially when managing client expectations during our own periods of grief. It's important to be open about our current emotional state and realistic about the support we can provide. Explaining that we're going through a difficult time but remain committed to their pet's care can help set appropriate expectations. Utilizing our professional and peer support networks can significantly ease your emotional burden by providing support, practical advice, and a sense of shared experience. Regular contact with colleagues can keep us grounded. Recognizing signs of emotional overload is also essential. Symptoms like feeling overwhelmed after client interactions, dreading work, or feeling unusually fatigued can indicate a need to manage our emotional load before it becomes unmanageable. When our capacity to support grieving clients is limited, referring them to additional resources like grief counselors or support groups is a practical strategy. This ensures our clients receive the necessary support while we maintain our emotional boundaries. Additionally, educating yourself, your clients, and colleagues about grief management techniques can help manage expectations and maintain emotional balance during interactions with clients. Mindfulness techniques, as simple as deep breathing before appointments or even during conversations, can prevent stress from affecting our professional composure. Monitoring that balance between our professional responsibilities and our personal emotional needs allows us to provide care without losing sight of our well-being and protects the sustainability of the services we provide. In this next section, let's explore developing strategies for emotional resilience. Resilience is our ability to recover quickly from difficulties or to adapt in the face of stress or trauma. It encompasses being able to bounce back from challenges and keep functioning even under pressure. Emotional resilience is a specific aspect of this broader concept, focusing on the ability to manage one's emotions and remain stable and functional emotionally despite stressful or adverse situations. This goes beyond mere coping. It's about thriving in our roles despite the emotional challenges. By cultivating resilience, we enhance our capacity to handle any situation effectively. Emotional resilience in the context of our work means the ability to recover from adversity, particularly the emotional challenges from loss and grief. And this involves self-awareness, self-regulation, and maintaining perspective under stress. Building resilience starts with self-awareness, recognizing your emotional triggers and understanding reactions helps us manage our responses effectively. Keeping a journal or practicing regular reflection can provide insights into your personal coping styles and needs. Setting professional boundaries is also crucial. This might mean deciding not to take calls after hours or communicating clearly when you need a break and taking that break. As mentioned earlier, building a network of peers who understand our professional challenges provides essential support. Also, don't hesitate to seek professional help if you're overwhelmed. Short-term counseling or therapy can offer new strategies for managing stress and get you through particularly tough times. Incorporating regular physical activity, relaxation techniques, or mindfulness practices into your routine can also significantly reduce your stress levels. Creating a personal wellness plan that includes activities that you enjoy, those that rejuvenate and inspire you, is also essential. Making sure your schedule includes opportunities for continuous learning by attending events like this can also strengthen your ability to adapt. By adopting these strategies, you empower yourself to not only face grief and stress, but to thrive despite them. Committing to continuous emotional growth ensures you're prepared for the challenges of pet care. Now let me turn our presentation back to Gail.
Thank you. And so before we end, let's focus on a crucial aspect of our work, which is reducing the stress of pet owners who are also acting as caregivers. Managing an animal's illness or end-of-life care can be an overwhelming experience for owners, and as pet care professionals, there are strategic ways we can support them through this challenging time. First and foremost, encourage them to gather information from reliable sources. This can help reduce uncertainty and anxiety, empowering them to make informed decisions about their pet's care. And of course, you need accurate, up-to-date information about the animal's condition and treatment options in order to provide the best care possible. Next, promote a collaborative approach to care planning that centers on family members, but also involves veterinary and allied pet care professionals in discussions about the pet's care. This strategy not only diversifies the types of support that the client can receive, but also ensures that all aspects of the pet's needs are considered and addressed, which eases the emotional and decision-making burden for the pet owner. As the animal's care becomes more complex, flexibility and adaptability become key. Encourage pet owners to be open to adjusting care plans as the animal's needs evolve. Offer support where you're able in problem solving, unexpected issues, whether they're medical, behavioral, or logistical. Helping them navigate these changes can significantly reduce their stress. It's also important to normalize their feelings of being overwhelmed. Assure pet parents that it's common to feel stressed when caring for a sick animal. Understanding that they're not alone in their feelings can provide a great deal of comfort and reduce any stigma or guilt that they might be experiencing. Regular encouragement can go such a long way. Remind your clients of the great care they're providing, the important role they play in their pet's well-being. Positive reinforcement can boost their morale and help them manage the emotional highs and lows of their journeys. Finally, encourage pet owners to consider seeking support from friends, family, or support groups who understand the challenges of pet caregiving. However, remind them that it's important to choose their support network selectively, focusing on those who truly understand and empathize with their situation. However, sometimes grieving in private is the best option if the right support cannot be found. We can play a significant role in easing the stress of pet owners who are caring for their animals during difficult times. Our support can make a profound difference in their lives and the lives of their loved ones, reinforcing the vital role we play as pet care professionals. And now, as we wrap up today's session, let's revisit the essential insights that we've discussed. These key takeaways are crucial for enriching our roles as pet care professionals, enabling us to manage our emotional well-being while providing compassionate care. First, it's vital to understand shared grief and how it affects you. This means recognizing that we often share in the emotional journey of the pet owners we support, feeling their losses as deeply as our own. Embracing this concept helps us to empathize more deeply, but also highlights the need for managing our emotional responses effectively. Second, always be vigilant for signs of emotional overload, whether it's feelings of exhaustion, detachment, or irritability. Recognizing these signs early can prevent burnout and ensure we continue to provide the best care possible without compromising our health. Third, we discuss the importance of establishing boundaries. This involves setting limits on what we can emotionally and physically handle. Creating clear boundaries helps maintain our professionalism, our personal well-being, allowing us to serve both our clients and ourselves better. Fourth, we covered various coping mechanisms for managing grief, from engaging in self-care activities to seeking professional help. These strategies are essential for processing our emotions constructively and maintaining our effectiveness as caregivers. Fifth, identifying and utilizing your support systems is critical. Whether it's colleagues, friends, family, or professional counselors, having a network of support can provide the strength and perspective needed to navigate the challenges of our work. And lastly, it's crucial to recognize the signs of compassion fatigue. Understanding its triggers and symptoms can help us to take proactive steps to manage it, ensuring that we remain compassionate and effective in our roles without sacrificing our well-being. And so in closing, we want to say that the support we offer our clients helps navigate the complex feelings of grief and loss they feel. by offering a shoulder to lean on, an ear to listen, and a heart that understands. It's about being there, walking together in moments of silence and in conversation, knowing the love and the loss that shapes this journey. You're not just providing care, you're offering comfort, understanding, and support during one of the most challenging times a family might face with their pet. Remember, the better we care for ourselves, the better we can care for the pets and people who rely on us. Thank you all for your commitment to compassionate end-of-life care and for joining this important discussion on navigating the path of grief in pet care.